Hello guys, this is Sonu and today I will be discuss about the cephalosporin second generation. In a previous time I discussed about the first generation, so today we'll discuss about the second generation. As I said that the cephalosporin is subdivided into four generation, first, second, third and fourth. So first I already discussed, today I will be discuss about the second, then after second we'll discuss third and fourth. So let's start about the second generation. As I said about the cephalosporin, this is the group of the beta-lactam. So don't forget about this. This is the beta-lactam antibiotic. Beta-lactam antibiotic. In the cephalosporin, we have penicillin, cephalosporin, monobactam, and the carbapenem. So, in the classification, it also subdivided into two parts, orally and parentally. All the cephalosporin group is the according to the classification for the easy to understand. It's divided into two group. Orally, it means those drug which belong to orally, all drug will be given orally, and the parentally means those drug which belong to the parentally, they always give parentally. This for example, this two drug is a parental, so this two drug cannot be given orally, always will give to parental, like intravenous, intramuscular. So the classification is the first cephaclor. As I said that the all cephalosporin group drugs start from the CEF. It's a common. So cephaclor, cefuroxime acetyl, cefprozil. These three drugs is the orally, and the parental is the cefuroxime. Actually, the both are the same, cefuroxime and cefuroxime. But here is the acetyl, means this is the structurally different, a little bit change, and it's a pro drug for the orally. That's why it's a there's the one what is the mention acetyl due to the orally. It's absorbed in the good absorbed in the orally. Then cefuroxime, it's a parentally. How will different we can say differentiate? We'll discuss. And the last in the cefoxitin. So this drug is the all drug is the belong to the cephalosporin second generation. Now we'll discuss that what is the differences between the first generation and second generation. Actually, it is the closely related to the third generation. Nowadays we can say the cephalosporin. If you talk about the cephalosporin, the most widely uses in the cephalosporin is the third generation, most probably. And the third generation drug is the highly we can say sensitive to the gram-negative bacteria as compared to the gram-positive bacteria. So the cephalosporin second generation is the very we can say nearly to the third generation, and it's a very less action on like the very less related to the first generation. Actually, in the first generation, that the gram-positive bacteria is the more sensitive and the very weak action on the gram-negative bacteria in the first generation. Okay, let's write here. In the first generation, that was the sensitive to gram-positive bacteria. For example, cocci, streptococci, meningococci. This types of cocci is very sensitive, and the very weak action on gram-negative. If you talk about it, the first generation, but now the second generation. Today discussing about the second generation. Actually, in the second generation, just the opposite thing. It's a sensitive to the gram-negative bacteria and very weak action on the gram-positive bacteria. And those gram-positive bacteria, which is the very good sensitive in a gram-negative bacteria. For example, cocci, whatever bacteria belong to the cocci, those bacteria is the very sensitive to the cephalosporin first generation. But in the cephalosporin second generations, this bacteria is the, like for example, cocci bacteria, cocci like streptococci, meningococci. These are the very weak action. If you give the second generation, it will almost no action or very weak action. And the sensitive to the gram-negative bacteria, but not all gram-negative bacteria. Limited gram-negative bacteria is the good actions, and along with some gram-positive bacteria also, but very not this bacteria cocci. Some of the drug, for example, if you talk about like cephalosporin. Cephalosporin is the this drug is the obviously this drug is the mainly sensitive to the gram-negative bacteria, but some of the it also work in the gram-positive bacteria. We'll discuss about. So again I will repeat that the cephalosporin second generation is the very nearly or very closely related to the cephalosporin third generation, which are very widely used and very highly sensitive to the gram negative bacteria, but very weak related to the gram cephalosporin first generations. Actually first generation it was sensitive to the we can say penicillin sensitive bacteria. So these bacteria are the cocci and mostly cocci bacteria. So that's why the first generation also very sensitive to the gram positive cocci bacteria. And the cephalosporin second generation, it is the related to the cephalosporin third generation but very weak on the cephalosporin first generation. That is the we can say if we can differentiate between each other. So these are the main differentiations, that how will we differentiate. Okay, so let's forward. About the first of all about uh, the sensitivity of the bacteria. So first of all let's talk about that which bacteria is the more sensitive here. Penicillin producing Neisseria gonorrhea. This is the we can say very sensitive to the this bacteria. After that, Haemophilus influenza. Haemophilus influenza and Enterobacter organism. Enterobacter organism. Enterobacter organism. Actually, in an Enterobacter organism, a lot of bacteria, for example, gram-negative bacteria such as Escherichia coli. So, Escherichia E. coli. Even some rods of bacteria also is there, which are in the group of the. It's a group of the bacteria, Enterobacter organism. That is the almost all gram-negative bacteria and gram-positive bacteria. Some of the facultative anaerobic and aerobic bacteria also is there. So, actually, we can say that these bacteria are the more sensitive in this drug. Actually, this drug can kill this type of bacteria mainly, and also along with this bacteria, some other bacteria can also can be killed. But the drug of the choice, or we can say very sensitive, this bacteria is the very sensitive to this drug. Okay. So about the bacterial sensitivity, I discuss. Okay, let's talk about that indications, that in which indications we can use. So from the bacteria we can suspect that what could be the indications. So let's talk about indications. Actually, after the cataract surgery, the chance of the development of the endophthalmitis, that is the inflammation of the interior of the eye. So endophthalmitis, it is the inflammation of the interior eye. So during this problem, actually after the cataract surgery, always the suspect of the bacterial infections. So in this time, if we cannot we give the any antibiotic, so endophthalmitis the suspect to be developed. And if this types of problem can be developed, so it become more worse than the cataract. That's why in these conditions, if we use the cephalosporin second generation, especially like cefuroxime or cefaclor or cefaclor, so these are the drug of the choice. So the suspect of this problem can be very less if we use cephalosporin second generation. So these are the main, we can say, indications. After that, due to the influenza, as I said, that Haemophilus influenza, then pneumonia, because in the gram negative bacteria, clavicella pneumonia can also be sensitive. This bacteria, obviously, we have the much best drug like cephalosporin third generation, but on the time maybe cephalosporin third generation is the allergy reactions, or maybe some other contraindications, or maybe the patient will not tolerate. On the time we can use this drug. After that, pneumonia, influenza, endothermitis, then otitis media, then pharyngitis. But pharyngitis is the mainly for the staphylococcus, so but we can use obviously, but these are the not drug of the choice. After that, some peritoneum diseases like the diverticulitis, diverticulitis, that is the inflammation of the abdominal pouch, and some pelvic inflammatory disease. So pelvic inflammatory diseases, but these are the, we can say, common indications, or we can say that drug of the choice also, we can say. So, and if you know the susceptibility of the bacteria, that which types of bacteria is the more sensitive to the in the cephalosporin second generation, so we can obviously find the main indications. Let's talk about that, about the mechanism of the action. As I said, that the all cephalosporin group, even all beta lactam group, not cephalosporin, we should say the all beta lactam, whatever drug is belong to the beta lactam, the mechanism of action are almost the same. They all are bind penicillin binding protein, and after the binding, it inhibit transpeptidase, that is the enzyme. This enzyme, they help to the linkage between each other to the peptidoglycan, and then maintain the cell wall of the bacteria. So if we inhibit the transpeptidase, so obviously the linkage between each other of the transpeptidase will not occur, and will not, we can say, stay. So it will destroy, and the bacteria become swell and burst. That is the main mechanism of action. So almost same, so no need to explain that how it will be bind and how it will be. We already explained on the first in the penicillin, when I was discussing about the penicillin. So you can watch that video. Another one, another information about this, that which bacteria, those bacteria which are synthesizing, or we can say secreting the beta lactamase enzyme. So that bacteria already said, that is the penicillinase producing Neisseria gonorrhea, Haemophilus influenza, and some bacteria like some family of the Enterobacter. These bacteria are already, we can say, synthesizing the beta lactamase, that is the enzyme, or we can also say penicillinase, but there here is the more correctly beta lactamase, because it's a beta lactamase, or cephalosporinase, that is become more and more correctly. So these all bacteria are, we can say, secrete the, or synthesize the this enzyme, and this enzyme is the very dangerous for the cephalosporin, because this enzyme is the inhibit the beta lactam ring, or destroy the beta lactam ring, and after the destroying, the drug efficacy become very weak. But this all drug are the resistance to those enzyme, that is the beta lactamase. So one also extra feature add here, that this bacteria, this drug is the resistance of beta lactamase enzyme first. Second one, this is the more sensitive to the those bacteria which I already said about, the gonorrhea, and Haemophilus influenza, and some Enterobacter organism, that is the gram positive, gram negative bacteria, and some rots of bacteria, for example Escherichia coli. So these are the more sensitive. That's why this is the, we can say, drug of the choice, this bacteria. So whatever pathology or whatever disease can be occurred by this bacteria, we can easy to we can say give this drug. So this drug is the most susceptible. After that, about the side effects. Side effects. About the pharmacokinetic, as I said that these are the orally, these are the parenterally, and this drug, as usual, it's going the metabolized by the liver, and very fast excretory system by the, we can say, tubular excretion, and one drug, that is the probenocid. This drug is the indication for the hyperuricemia. So but whenever you giving the both drug in the same time, so probenocid can be inhibit or can be slow the metabolism of this drug. Even all cephalosporin drug, not this drug, all cephalosporin. That's why keep in the mind that probenocid we cannot give in the same time whenever we're giving cephalosporin, any beta lactam, only many cephalosporin, and the rest are the same pharmacokinetic. About the side effects, side effect also the same. That common side effect is the nephrotoxicity. After that, hepatotoxicity, then neurotoxicity, hypersensitivity, and don't forget about superinfection. What is superinfections? Superinfection actually, it's inhibit our normal flora, which are good for our health. That flora is the synthesizing some lot of protein, lot of protective factor, and some vitamins. So if we inhibit this flora by any way, by the drug or by any reasons, so it will start some another pathology. So it's the same here. By this drug, if you're using prolonged use or very high doses, it can be inhibit our normal flora, and it can be superinfections can be developed, and we can say that the fungal infections can be developed. So on the time it become more worse. That's why we have to use in a very limited dose, and we can say not we use very prolonged time. So that's why we have to keep in the mind that whenever using this drug, superinfection should not be developed. If superinfection will be developed, so it become more worse than that pathology who are for the that pathology that taking this drug. That's why this is the very, we can say, even severe condition. Superinfection should not be developed while using the antibiotic, any antibiotic. And hypersensitivity, the same hypersensitivity, but here is the one benefit that this drug is the less cross sensitivity. What is the cross sensitivity? It means that these all drugs, beta lactams, penicillin, all drugs which belong to the penicillin, all drugs which belong to the cephalosporin and monobactam and carbapenem, this drug is the structurally same beta lactam. It means, for example, those person who take the penicillin and those person have penicillin reactions, means that about the 10% of the people have penicillin reactions. So those persons who have penicillin reactions and the same person, same patient is taking cephalosporin, might be develop the same reactions, hypersensitivity. But in these cases, the cephalosporin second generations have very less cross sensitivity. That is the cross sensitivity. What is the cross sensitivity? Means the different types of classification, but the structurally the same. That is the beta lactam. Means the penicillin have different classification, the cephalosporin have different classification, but are structurally almost the similar. That's why in this case, cross sensitivity can be developed. That is the cross sensitivity. But in the cephalosporin second generation, the cross sensitivity is a very less. It can be, but very less as compared to the other like first generation and third generation. Neurotoxicity, those persons who have some epilepsy attack and some other neurological disorder or psychiatric disorder, on the time we should decrease or we should avoid the cephalosporin antibiotic. It can be increase the epilepsy attack or some other neurological disorder, can be enhanced. Then hepatotoxicity. Obviously, the all drug is that detoxify or metabolized by the liver. So obviously, who have liver problem, no need to confuse. It should be avoided or it should be decrease the dose. Nephrotoxicity. always because kidney also take part in the huge detoxification in the drug and lot of toxic substance in the body. That's why who have kidney problem should be avoid or decrease the dose. And here, from here you can also suspect about the contraindications who have nephrotoxicity, very severe chronic liver pathology, and he have severe neurological disorder, hypersensitivity, and super infections. They all are the contraindications, obviously, but it depend upon the severity of the diseases. Along with this, also bleeding can be occur because it suppresses the bone marrow. So neutropenia, thrombocytopenia obviously can be occur. So anemia, who have chronic anemia or severe anemia should be avoided or should be contraindications. And if like we have to use no any other option because this is suffering from or he is suffering from bacterial disease, on the time we have to very careful the maintenance of the patient, and the dose should be reduced even in the below the normal, like the whatever the therapeutic dose. Therapeutic dose means the normal dose, so we should below the therapeutic dose should be give. So these are the normal we can say this side effect. It's all antibiotic, even all cephalosporin groups, and contraindication they all the same. After that, let's talk about some difference between each other of the drug. About the cephalosporin, this and this, what is the difference? After the eating of this drug, it is the ester, or we can say ester prodrug, means it will be activate after the eating. It's a like whenever it's in a before the eat, it's a inactive form. Prodrug means that before that it's active form. It's active within the body. So whenever this cephalosporin acetyl will eat the person or patient, it will activate in the body, and after the activation, it will release the finally cephalosporin, and this will be the work. So so that's why this drug, the efficacy or work of is depend upon the whatever amount it will be activate in the body, whatever amount after the eating this drug, how much amount it will activate and finally release the cephalosporin. So these are the main we can say active form, and this will be kill the bacteria. So that is the main difference, and almost the same mechanism because the same drug, it's just add due to the ester prodrug, because of it will be it should be active in the orally. Then about the cefoxitinine, actually this drug is the not we can say common drug. This drug is the for example in India, this drug is not available in the India. Some of the countries is available, but some of the countries not available. So actually this drug have the both gram positive and gram negative bacteria. Some of the gram negative bacteria, as I said, about those bacteria which I discussed, and about the some gram positive bacteria, it also like some anaerobic bacteria. Some anaerobic bacteria can also suspect. That's why we can use this drug in some gram positive and some gram negative bacteria. For example, as I said that inflammation of the abdominal area, abdominal pouch, peritoneum, on this types of problem can be used. But this drug is not common use because this drug not available in all over the world. Some of the countries are available. About the cephalosporin, cephalosporin is the mainly active against the gram negative bacteria. Those bacteria which are producing the cephalosporinase or beta lactamase, that is the gonorrhea, like penicillin is producing Neisseria gonorrhea, Haemophilus influenza, and some Enterobacter, that is the Escherichia coli, and some Rotse bacteria. And also after the cataract operations, after the surgery of the cataract, the more susceptibility to develop the endo-ophthalmitis. So on the time also drug of the choice. About the cephalosporin. Then cephalosporin. About the cephalosporin. About the cephalosporin, it is the active against the same gram negative bacteria, but some of also it's active against the streptococci or streptococci and the staphylococcus. especially in cephalosporin. And along with this, also gram-negative bacteria like the as I said, the same almost the same bacteria like Klebsiella, Escherichia, like the Enterobacter, and obviously Neisseria gonorrhea and Haemophilus influenza. That's why there are two additional bacteria, Staphylococci and like the cocci bacteria. That's why indications should be increased, like the bronchitis, ENT infections, and some skin infections can be uh, as indications we can use. But obviously, whenever this types of problem can be occur, we have very special drug like the penicillin group and cephalosporin first generation, and some other classification, not the beta lactam, maybe some aminoglycoside or some macrolides and some other bacteria, other drug, other antibiotic drug. But we should know that maybe this drug will be help in a very rare conditions when all drug is the contraindications on the time. Maybe this drug can be used. That's what we have to know that which types of drug is the more susceptibility to the bacteria, which bacteria. About the cephaclor, actually the cephaclor, it's a mainly active against the gram-negative bacteria, mainly gram-negative bacteria. And which types of gram-negative bacteria already I discussed. So I think this all information about the cephalosporin second generation, and also about the antabus reaction or disulfiram reaction. What is this? Means those person who taking alcohol along with the cephalosporin, all cephalosporin drug will not occur this antabus reactions. But maybe some person have cephalosporin second generation antabus reaction, and those person don't have cephalosporin first generation. That's why usually we can say normally we should avoid alcohol while this drug using. So completely avoid, absolutely avoid those person who taking alcohol. So we should inform them that while using this antibiotic, don't use alcohol, or maybe antabus reactions can be occur. What is antabus? In the previous time I discussed about that during alcohol will be converted into acetaldehyde due to the alcohol dehydrogenase. Alcohol, okay, should be so the person is drink alcohol. Normally I'm talking about physiologically. Alcohol will convert to the acetaldehyde by the help of alcohol dehydrogenase, and then acetaldehyde will further convert to acetic acid by the help of aldehyde dehydrogenase. But acetaldehyde normally in the body it's a, we can say, harmful chemicals. If in a body, in a blood, it will increase, a lot of side effects can be occur. That's why it should be converted to the acetic acid. So normally the person take alcohol in the normally present our in the liver special enzyme alcohol dehydrogenase. By help of this enzyme it will convert into acetaldehyde, and after acetaldehyde it further convert to the acetic acid, and the acetic acid will further go in the reactions and so on. So this acetic acid will convert by the help of aldehyde dehydrogenase. So this drug or those drug who have antabus reactions, the all drug will be inhibit this enzyme. Actually in a previous time by mistakenly I said about that drug it's inhibit alcohol dehydrogenase, but that was the wrong. Actually it's inhibit the aldehyde dehydrogenase. So actually that time I didn't mention about the alcohol dehydrogenase. That was a mistake. So here I'm correcting that aldehyde dehydrogenase, the all drug who have antabus reactions or disulfiram like reaction, this drug is inhibit aldehyde dehydrogenase. So those person who taking alcohol and along with this drug or those drug who have this types of additional, we can say, effects. So this drug will be inhibit the aldehyde dehydrogenase, and after the inhibiting aldehyde dehydrogenase, the concentration of the acetaldehyde in a blood become increased, and after the increase this, as I said that whenever it's increased, it can penetrate the blood-brain barrier. So lot of neurological effect can be seen like delirium, hallucinations, and some like the very we can say aggressive effects, vomiting can be occur, tremor can be occur, blood pressure can be increase or decrease. So these types of problem can be occur. That's why those person who taking alcohol, we have to inform that don't use alcohol during the this medicine, whenever you're taking this medicine, along with the never, absolutely contraindication. We should even more morely say that if you use this alcohol, your problem become too worse. That's why don't use. So this is the main mechanism. And even all drug who have, like for example disulfiram, it's a anti-abuse drug, anti-alcoholic drug. Those person who want to leave the alcohol, who want to stop the drinking alcohol, so those person can be used this drug, because this drug is the inhibit aldehyde dehydrogenase. And after whenever they're taking alcohol, they have very severe effect. They have very vomiting and very delirium type, a lot of neurological types of side effects can be occur. So by the fearness, they will not drink the alcohol. Okay, so about this all information about the second generation of the cephalosporin. In next time, I will be discuss about the very important or huge drug which are nowadays mainly uses in the cephalosporin, that is the third generation. So next time we discuss about the third generation. So thank you so much. Till then, take care.